Friends, I'm Dr. Pradeep Mahajan, researcher in stem cell and regenerative medicine at StemRx Bioscience Limited. We all at this moment are going to a very critical phase. The phase which is challenging in a social life, in a personal life, and a commercial and economical life. Though we are coming over it in acute form, successfully finding a way coming out of from COVID-19 infections. But unfortunately, COVID-19 infections is giving us a huge morbidity on various conditions, various systems. The most important is the lung, sinuses, and GI tracts and neurological. I would rather talk this as a very unique condition where the entire body is affected, but some of the systems takes an overload. Now, there are no treatments for this kind of post-COVID syndrome diseases, which are symptoms which you call like a lung fibrosis, interstitial lung fibrosis secondary. Now, what happens here actually, though we come out of the RNA infection of the COVID-19, but the protein deactivated when the COVID virus is deactivated, the protein of RNA remains in the tissue and it causes you consistent, persistent, progressive fibrosis leading to lung fibrosis. Now, could be a problem in the future, and the treatment part we don't have at all in StemRx has brought in a new technology, what is called as a nebulization using lyophilized platelet growth factors. Now, what does it mean? Now, it means the first healer of the body, in the healing system of the body, the active actor in the healing systems are the platelets which are present in our body. These platelets, wherever injury we get, the load of trauma you get in the form of infection, in the form of trauma, in the form of hemorrhages, the platelets come into first action to play in the healing process. As well, if you remember, any of your friend or any of your family member who has suffered from malaria or dengue, we always have treated in a case of thrombocytopenia, bringing platelets in the blood from the blood bank and transfusing that. This indicates the platelets are remain very safe to use in the therapy. The examples which I quoted are particularly malaria and dengue, which we routinely use it like. Now, these platelets as StemRx are lyophilized, brought into amorphous powder, into sterile condition and standardized into growth factor. I recommend to use these growth factors, particularly using 2 ml normal saline distilled water to dilute that powder and put into a nebulizer machine. What is nebulizer? Nebulizer is a machine which is saline or steroid inhalations. In place of putting saline or steroid, you have a safe product prepared from your own blood, some kind of platelets. Use it into nebulizer, and these technologies are 100% safe, where the bioactive molecule of a growth factor in the form of cytokines, chemokines, and growth factors and exosomes, they go and home on the direct disease burden organ of the lung, where you can say fibrosis, capillary alveolo-capillary margins, where the perfusion and exchange of gas is reduced. And this technology is only the worldwide first technology to treat the lung condition in the post-COVID syndrome. If you take 2 times, 3 times, just a nebulization and breathing exercises. Nebulization, it takes 5 to 10 minutes for you in the morning, afternoon, evening, initial period for a week, then twice a day in a week, and then once in a day for a month, will bring your lung fibrosis, stop the progressive disease, first of all, which is a progressive. Second, it will also reduce the fibrosis. Third, it will improve the perfusion of the capillaries. Fourth, at alveolo-capillary margins, it improves the gas exchange, that's the oxygen exchange. Now you can see the simple LPRP prepared from the platelet can change the fate of your lungs. My recommendation to use in a nebulization, lyophilized platelet is a life-saving procedure or saving from the morbid conditions of the lung diseases, which are supposed to be used in a long-term procedure for a month or 2 to see the physiological changes taking place in the lung. We can assess by lung function test or x-rays before and after the treatment of nebulization. to see the changes and clinical parameter. Most important, 6 minutes walk test. Earlier you may be finding difficult, but later you can easily complete 6-minute brisk walk. Even if you are limited disease, you can reverse back. When you have minimal fibrosis, you can reverse back. Even if it's advanced fibrosis, you can reverse back. But most important, thereafter continue respiratory exercises, which is more mandatory, a complementary treatment along with nebulization. Thank you, friends. I hope I have given a new hope of therapy. Nebulization using lyophilized platelets could be a game changing in post-COVID syndrome. Thank you. I'm Dr. Mahajan, as I said in the beginning. You can note down my email address drpvmahajan@gmail.com or drpmahajan@stemarx.in, and my mobile number 8898070904. Anyone who is confused and find this disease or post-COVID syndrome troubling you and taking you towards a morbidity, please get in touch with me. You can have a guidance from me as well as therapeutic advice. Thank you.